Wyoming Senator and Dr. John Barrasso is chairman of the Senate Republican Policy Committee. Good to have you with us this morning, Senator.
Thanks, Shannon. Great to be with you.
Okay, so you have heard the critiques from your Democratic colleagues, including there in the Senate Minority Leader Chuck Schumer. He says it's a nightmare unless you happen to be a healthy millionaire. So where does the conversation now go in the Senate? Will you take any of what's happened in the House bill? Are you starting completely from scratch?
Well, we're writing our own bill, but the nightmare itself is Obamacare. I mean, why are we here trying to write a new health care law? This isn't a replacement. It's a rescue for what's happening around the country. The CBO has a credibility gap in that they've been wrong so often about Obamacare. But let's talk about the facts today. What we know is the last 4 years, insurance premiums under Obamacare have doubled in the 30-some states where they just have the Obamacare exchange. And just yesterday, Blue Cross Blue Shield of Kansas City has pulled out of Missouri and Kansas. So there are people there who have no options to buy health insurance at all. In Wyoming, we're down to one choice, but now there are places around the country who nobody is selling because it is such a bad deal that so few people are buying.
Yeah, and there's been a lot of question about the CBO's estimates. I mean, they're working with numbers they're provided. These aren't perfect. We want to give you some examples, though, so people know what we're talking about when we reference how off they were about some of the Obamacare predictions. They estimated 20 million people would enroll in Obamacare exchanges. In reality, it's closer to 10 million. They predicted 4 million people would enroll in an Obamacare small business program. The actual number, less than 250,000, 233,000. And they drastically underestimated Medicaid expansion predictions. Medicaid expansion costs ended up being 62% higher than they expected for $26 billion. Now, I know that these programs and the expansion of Medicaid and Medicare, that's been a hot topic. We know it is one of the sticking points in the Senate. Knowing how far off the CBO was in the wrong direction, how do you and your colleagues iron that out now on the Senate side with this new reform?
Well, we're continuing to look for ways to lower premiums. I mean, that's what I hear about every weekend. I was at a health fair in Lovell, Wyoming this weekend. People are saying the premiums, the costs are too high. We got to lower the premiums. We also need to protect people with pre-existing conditions, and we're working on that. But this is a rescue operation for the people who have been caught in the collapsing Obamacare exchanges. We need to provide something so that they can actually get insurance. And that's what we've been working on. We'll meet for a couple of hours today. We met yesterday, the day before. All the Republican senators are involved with bringing forth their best ideas to get this done. And we go home every weekend and then come back with the best ideas from around the country.
One of the most critical sticking points on the House side was this idea of state waivers, which ultimately was part of what they passed, that MacArthur amendment, that would allow states to opt out if they can prove they have other safety nets from a number of things that people say will drive up costs for those with pre-existing conditions, for older people, for less healthy people. The CBO's estimate now says that a sixth of the U.S. population, they think, will be in states where they get those waivers. And those people are going to be impacted by higher prices.
Well, I read the entire report. I mean, it's interesting. They make assumptions. They say half of the states won't do anything. They say a third of the states will do marginal changes. And then a sixth of the states, they say, will go further. But I was in the state Senate in Wyoming, and as a doctor and as a state senator, I always felt we could do a much better job in Wyoming if we did it the Wyoming way rather than the Washington one-size-fits-all way. So I encourage states to take waivers, make decisions on their own, do what works best in that state, not what Washington says you have to do. And I think that was one of the major problems with Obamacare, Shannon, from the beginning.
All right, let me get you to respond to this CBO example as well. They give us a 64-year-old who's earning $26,500 a year. They say their premium under what the House passed would spike 800% from about $1,700 to $13,600. Is that a framework the Senate can work with?
Well, no, we are actually working on dealing with that. Senator Thune from South Dakota has been very active in an amendment to help try to smooth that out in a better way. We want people to have affordable care so they can get the care they need from a doctor they choose at lower costs. What we've been seeing with Obamacare is people can't keep their doctor, can't keep their insurance plan. And when you have people that have been going to a doctor and they find out that even under Obamacare with the narrower networks, they can't keep their doctor. And if they're going to several doctors and can't keep any of them, that's another violation of the promises that President Obama has made. We need something that was better, Shannon, than it even was before Obamacare was passed. I said that as a doctor years ago. We need a better system for America. It's interesting that California is now proposing universal coverage and care for everyone, and they costed it out. And they said, well, it's $400 billion, which is more than twice the cost of the entire budget of the state, which means you'd have to get rid of police, teachers, firefighters, and raise taxes to get what the folks who are talking about universal coverage want.
Yeah, and that math doesn't seem to work. Okay, Senator Barrasso, good to see you, sir. Thank you for your time.
Thanks for having me.